Where can I find the right doctor? One who listens, is trustworthy, knowledgeable, and cares for me.
When life is uncertain, when you don't know what's next, we're on your side to help you find answers and understanding. With over 600 providers, Slu Care physicians combine an advanced approach to medicine with a human approach to you. It's what we call informed medicine.
The gateway to the West, Cardinal Nation, St. Louis, Missouri, is the home to some of the most brilliant physicians in the world. These doctors are pushing science to its limits, healing patients in new, innovative ways, and doing it at the same time they're teaching the next generation of doctors how to save lives. Meet Dr. Sagun Goyal, hematologist, internal medicine, and oncologist, who is offering CAR-T to patients battling leukemia and lymphoma. This is the science of healing.
CAR-T is fascinating. What it does is it's that principle of using the immune system. So we believe that in cancer, and particularly in some of these lymphomas and leukemias, that they evade or get around the immune surveillance, and so that is what lets them grow out of control. So we kind of try to play on the immune system and capitalize on it. We take a patient's own T cells. T cells are the cells we think about as perhaps keeping cancer in check. They're also the cells that we think keep infections in check. And we basically take those T cells out of the body. They get sent off to a lab where they kind of get manufactured, mutated. There's a lot of different words we can use to learn how to attack a specific protein on the surface of the B leukemia cell or the B lymphoma cell. Once those cells are kind of mutated, grown to an adequate number, they actually come back to the facility where the patient is being cared for, and they are ready then to administer as basically what we call a live medicine or a live product. We put those back into the patient, into their bloodstream, and our hope is that they will go find that cancer, almost treat it like an infection, attack it, and then ideally put that cancer into remission. How do we get the CAR T cells and how do we put them back so that they can do their job? We actually put the patients on a machine that effectively makes them their own blood donor. So if you imagine a healthy volunteer giving red blood cells or platelets, in this case, imagine the patient being their own blood donor, and in this case, they get hooked up to a machine that pulls out blood, takes away their T cells, and then returns the rest of their blood into them. Those T cells are then sent off to these specific pharmaceutical companies that manufacture these CAR T products, and then those end up coming back to the facility where the patient's being treated, and then they actually come back as a frozen product, just so we don't lose viability. But we thaw those right at the bedside, and then we reinfuse them and put them directly into the blood, where then they take over and kind of do their thing throughout the body.
Four years ago now, I had just a second. I had these lumps in my lymph nodes, swollen, and it was lymphoma. And I went and seen Dr. Goyal, and she just knew everything all about it and fixed me right up.
Donnie Barber, so a gentleman that I met who is fairly healthy. I believe he might have been in his late 50s or early 60s when I first met him about 4 years ago. He had actually just noted some swelling in his neck, saw an ear, nose, and throat doctor, had a biopsy, and was diagnosed with actually a very aggressive variant of our common non-Hodgkin lymphoma called diffuse large B-cell lymphoma.
She was just real confident that we would, beat this thing. Just, gave me all the confidence in the world.
So at that point, I gave him aggressive chemotherapy. He met all the milestones that we look for. So early on in treatment, that the lymphoma kind of melted away, responded to treatment nicely. And then by the end of finishing what we call 6 cycles of chemo, he was in complete remission.
I would go in, it's like a 5-day treatment, and on chemo for 5 days, and then get out of the hospital and go back in 3 weeks later and have another 5 days.
We kept him on just a monitoring plan at that point, where we usually check in on him every 3 months. We do scans about every 6 months. And for these aggressive lymphomas, we usually tell our patients that if we have not cured you, meaning if there are some cells left behind, they are likely to show themselves pretty quickly. They're not going to kind of sit quiet, sit dormant for too long. So once they get to the 2-year mark, especially if they've not had any signs of recurrent lymphoma, we usually tell them that there is a very good chance that you will stay in remission long term. So unfortunately, we had just had that positive conversation, and just about 3 months after that, he called us noticing some recurrent swelling in his neck. But we were concerned. He obviously was concerned because he had been through this once before. We brought him in, did the scans, the biopsies, and unfortunately confirmed the recurrence of that same original lymphoma. This time, unfortunately, it was much more widespread. It was throughout his entire body. That was not the way it was when we first treated him. It was really just localized to his neck. We talked to him about our standard plan, which is we have this difficult conversation of, it sucks that it's back, but at the same time, you are still well enough for us to consider you for aggressive and still what we call curative therapy. That aggressive curative therapy involves getting more rounds of chemotherapy. And if that chemotherapy works and puts them back into remission, we then take them to something called autologous stem cell transplant. That is a high-dose chemotherapy with autologous, so patients' own stem cells, rescue. That only works if they respond to chemotherapy. In Donnie's case, though, he did not respond to the chemotherapy that we gave him. So the possibility of taking him to this curative auto transplant was no longer there anymore. And we were really fortunate to have CAR T therapy available to us, because what CAR T therapy does is it basically says, I don't care if these cells have outsmarted chemotherapy. I'm going to use a whole different mode of attack. I'm going to manipulate those T cells or the immune system to now try to control this lymphoma.
I have a central port. Best I remember, they put another one in beside of it so they could take out of one and go back into the other. And after that was over with, they took one of them out, but I still have the one. And it took maybe a couple hours to get what they needed. It wasn't painful. And luckily, I was kind of scared at first about the sickness and everything I've heard about, going through chemo, but I was lucky and never once got sick.
He was fortunate in that even while we were waiting for these T cells to be manufactured, though we could see these lymph nodes kind of growing in front of us, he had swollen lymph nodes in the neck, he definitely had them internally. He was still relatively well. They didn't get him into any trouble from an organ function standpoint, so he was able to wait. And so he waited, we got the CAR T cells back, and then we're able to infuse them.
Everything is, it just really turned out good. And so far, it's still staying away. I had all the confidence in the world in Dr. Goyal. She's just really down to earth. She's really caring, explains everything, and just a great overall person. It's just, words can't really describe her.
Before we had CAR T therapy available to us, there was going to be very little treatment that I could offer him. I would have been able to tell him, there's more chemo to prescribe. Yes, I could send you for an experimental trial somewhere, but I would not have been able to tell him that there would be anything that had potential to give him years of life back. And so that part of things, I'm so thankful to have this option for our patients.
It makes you appreciate things. A lot of little things even, you wouldn't think about. But I'd say I got a new lease on life. Really amazing thing of how scientists can do what they do and help people like me.
It started when I contracted shingles in January of 2021. And as I was treating for the shingles, I incurred some symptoms that were unusual. The symptoms were that I was having a lot of fevers, high temperature fevers like 104.9 and 105, and I was sweating to where the entire bed, I'd wake up and the entire bed was covered in sweat. And I told my general practitioner that I was having those symptoms. He says, that's not shingles, that's something else. And he referred me to an oncologist. The doctor saw me and immediately started me on chemotherapy. And they also did a biopsy to stage me, which basically means to figure out what type of diagnosis I had. Well, it turned out that the diagnosis was not the correct diagnosis, but it was the diagnosis that the doctor thought that it was. What happens now to me? I've been from April of 2021 till about August of 2021, I've been having my body pumped full of the wrong chemicals, basically. And you're angry, you're frustrated, you're scared, and you want to know what to do next. And the solution, second opinion. And I went and searched around for another doctor.
Stephen was also just a really, really gratifying story for me, but definitely we had our share of scares over the course of his treatment. So I actually picked up his care last fall and basically had actually had his diagnosis revised from a kind of a slow-growing lymphoma to the more aggressive diffuse large B-cell lymphoma.
The sweats were back, the fevers are back, I've got no treatment going on, and I'm looking for a second doctor. For me, it was a race against time, because if I don't get that cancer or what they call lymphoma, if I don't get that out of me, pretty much I'm headed towards death. I don't know how long I would have had, but I would certainly not have, I don't think I'd have been alive today were it not for the subsequent treatment with Dr. Goyal, who I have so many wonderful things that I can say about Dr. Goyal.
He came to me with the hope that we would change treatment plans, but unfortunately what happened as this diagnosis got revised and we started to plan for a new round of chemotherapy is that his spleen, which was always very much affected by this aggressive lymphoma, just continued to get very, very big on us.
I could feel it was like a small baby growing inside me. My stomach was, and I'm indicating that my stomach was pushed over to the right. I couldn't hardly eat anything, couldn't get anything down because my stomach was cramped, because the spleen was growing.
It was all the way down in his pelvis. It was unfortunately at risk of probably even rupturing. It was also trapping a lot of his blood, so it made it where he did not have good blood counts at all, and he was kind of always at risk for infection and bleeding. Dr.
Goyal made a command decision. If we take the spleen out, then you're not going to have part of your immune system for the rest of your life, or leave it in. And she said, no, the first thing I'm going to do, and let me tell you about Dr. Goyal, another wonderful thing about her is that she will research, consult, she will make sure of herself what the right treatment is before attempting anything on you. And it's really good to know that you've got a doctor like that invests so much of her time in her patient like that.
So one of the first things we did as we kind of entered our partnership is we took his spleen out, which is never a trivial thing. He needed time to recover from that. In the time he was recovering from that, the lymphoma started to grow elsewhere, of course. We got to the point where he was recovered well enough from having his spleen out, and we were able to start some more chemotherapy on him.
She got the diagnosis perfectly right. She made sure of what that diagnosis was. So now I had a diagnosis, finally, with Dr. Goyal's professional help. And I was glad to at least know what it was that I had. And then we attacked it with certain types of chemotherapy.
The chemotherapy only partially worked, and so we actually started planning for that CAR T therapy right off the bat. So there were some inherent delays in being able to get to the point of even committing him to that T-cell collection. And so the delicate balance we're struggling with there is always, how can I do enough to keep your lymphoma in check so that you don't get sick? But how do I not give you so much treatment that I damage these T-cells and still protect them to be collected and ultimately do their job for your lymphoma? So that was, we were trying to give what I like to call hemolite. and Chemolite was not working well for him. He struggled quite a bit with a lot of symptoms related to his lymphoma, high fevers up to 103, 104, constant night sweats. He's an attorney and was just so incredibly motivated to try to get as much work in as possible before he knew he was going to have to stop for this procedure. And he was trying to work through all of this. It seemed like every day got hard for him to get through. And we knew he had a vulnerable immune system because we had taken out a key part of it, his spleen. So we were always kind of living in fear that we were blaming a fever on lymphoma, but it was really a sign of infection. And we had a lot of these, we'll come in and get checked out. Let's prove to ourselves we're not dealing with infection. So unfortunately that went on for a couple months.
That's when she and her team determined that I was eligible for a state-of-the-art, which is a state-of-the-art procedure in the whole world, called CAR-T, C-A-R-T therapy.
We did the CAR-T procedure.
And now there's just this massive team of T cells that are now roaming around your body looking for cancer cells to attach to, burn up, and kill.
And it started off, the first week seemed like it was fine. And then we started seeing all the complications that we kind of counsel the patients and their families on. So we started seeing what we call that CRS, which is known as cytokine release syndrome. That is that surge of inflammation. So high fevers, low blood pressure, things like that. He actually went to the ICU temporarily for that, was able to come out, and then I actually was rounding on him as he was riding the exercise bike in the hospital. I said, we're good, this is wonderful. And then he started to get what we call the neurotoxicity.
They said I went completely downhill and I was non-responsive and I ended up in the ICU.
So he went from, I remember it clearly, a Sunday afternoon, riding his bike, us joking with him, to getting to the point where he was having trouble answering some simple questions, to just then outright getting obtunded and not being able to speak or converse with us. We had to send him back to the ICU, and basically he lost a solid 2 days of his life. He doesn't remember anything that happened.
I was told that I couldn't remember my name. I couldn't write on a straight line. I don't even have a memory of it. My wife came, thank God, and I remember her face looking at me, but I don't really, it was it was in my head that she's there, but I couldn't process it. So it really affected my brain and the rest of my body going through it. But that battling this whole year since April of last year, it's just you don't know if you're going to make it. It's a scary thing. I don't wish cancer upon anybody. I have a lot more compassion and empathy for those that get cancer, or really any major disease for that matter. It really changes your outlook on life.
We gave him high doses of steroids to counteract the inflammation that was hitting his brain. He fortunately did come out of that fairly quickly and came to and was able to be awake, alert, converse with us. And then about 2 to 3 days after that, he was fortunately able to leave the ICU and then was back on that exercise bike. And then about 3 to 4 days after that, we were able to get him out of the hospital. He has spent the 2 to 3 weeks out of the hospital kind of building his strength back up, just kind of getting back to some normalcy. And then that led him to kind of that first milestone we look for, which is what we call our day 30 or our 1 month assessment. In his case, he had a lot of lymphoma in his bone marrow, and he had a lot of lymphoma in his lymph nodes. So we did scans to look at the lymph nodes. We did a bone marrow biopsy to look there. And I was just able to call him Monday evening and tell him that both places showed no evidence of lymphoma.
How I felt when I found out that I was in complete remission was, I can't believe it. I didn't think this was possible. I feel ecstatic. I feel that I have a shot at life again.
It was such a happy conversation for us. He told me all along, Dr. Goyal, we're going to beat this, and he knows, and we all approach this with optimism, but still some caution. He knows that it's early, but he knows we have met that first milestone, and unfortunately not everybody gets to that milestone at day 30, so that was a good visit for us.
she saved me. We sort of made a pact together that we were going to win this battle. Now that I was told I was in remission, now I get to be back doing the things that I want. I think the first thing that Novelle and I did is she came into the chair that we have a chair that we sit in, and we hugged each other and laid in the chair and watched TV. We were just so glad that I'm back. Here I am. I can't believe it.
There is a rich future for CAR T, and I could probably talk for hours on this, but I'm going to try to break it down into a few categories of where I see CAR T therapy immediately going. So definitely trying to identify the patients that are not going to benefit from chemotherapy, transplant, all that right off the bat. We are already moving in the direction of saying we are going to sign those patients up or kind of channel them down a CAR T route much sooner than we've traditionally done. So that's one area of progress for sure. The second is this idea of using off-the-shelf CAR T cells. So saying I don't have to wait for a manufacturing slot. I don't have to wait three to 4 weeks for these cells to come back to the patient. One thing we didn't even talk about yet is that unfortunately some of these products do fail manufacturing, and that can be because these T cells that have been through chemotherapy after chemotherapy are literally beat up. And so for those patients that fail, we're sitting there waiting to get these back, and then we learn, oh, by the way, you're not getting these cells back. If we have cells that were already on the shelf, kind of ready to take and prescribe to this patient, that would help outcomes quite a bit. The other exciting thing that's being done is, specifically in the field of B-cell lymphomas and leukemias, unfortunately, the CAR T is not going to work for everybody, and we do think some of the reasons these CAR T fails might be because there's only one protein that we're attacking on the surface of the cancer cell. So they're starting to look at, can we engineer these T cells to attack more than one protein? And that way, if one mechanism fails, we kind of have the backup or the secondary mechanism. So that's been really exciting, and we've heard some preliminary data on that. And then finally, these are T cells that are being grown in a laboratory, but we know the immune system is very sophisticated. And so the question is, how do we use our knowledge and get those T cells to grow to higher numbers, to grow in a way that they work differently? And so one of the things that's being done is basically when these cells are being cultured, they're kind of changing the bath that these cells are growing in. They're stimulating them in different ways to say, when these come back and go into the patient, can they work differently then? So that's just a small snapshot of where the field is going. I think these CAR T cells are being looked at in many cancers, both blood cancers and non-blood cancers, to see, can we use this therapy of kind of igniting or manipulating the immune system to attack a broader range of cancers. We have the benefit not only of having a strong oncology program, but we actually have some really amazing strengths kind of nationally and internationally, like our infectious disease group that does all of the vaccine trials. We have just a wealth of expertise and research in the basic principles of the immune system. And my dream is obviously to collaborate with those physicians and figure out how do we use their skill set then to help oncology and blood cancers. We have an outstanding liver diseases and hepatology and transplant group. So actually we've used all these specialists to help us form guidelines to care for our bone marrow transplant patients as well. We have a liver guideline, we have a vaccine guideline, and they've been key in helping us care for these patients.
If you ever want to win a battle with cancer, I would tell that person to go straight to Dr. Goyal at St. Louis University Hospital and interview with her. Cares deeply about her patients, spends incredible amounts of time with the patient.
She's, like I say, she's nice. I mean, considerate, thoughtful of you, and worries about you too, I think. And she just seems like a good friend. Just really nice person to be around.
I think my first meeting was practically 2 hours. by my estimate. She is really good with listening, understanding your needs, and explaining things to you that calm you, make you feel good as best as she can.
Yeah, I would definitely recommend her to anybody that had cancer or that kind of illness where she could help, because I think she really knows her stuff.
And she's got an outstanding staff, the whole staff at St. Louis University Hospital, top to bottom.
Everybody up there just like going visiting old friends.
I feel very good about Slu Care, their staff. I would joke around with the staff. There were times when I didn't feel good and I was crabby, I guess, grumpy, because words would come out of my mouth when I was feeling really, really bad. It's like worse than a flu. And they would not react negatively. They understood me. They understood what I was going through. I didn't have a bad experience at all. At that whole hospital, it's kind of a newer hospital. They rebuilt. I don't remember when they did that, but it's a great hospital. And Slu Care is fantastic.
I love working at Slu Care Physician Group. So this is what I always tell our patients and I tell my colleagues. There is something about the culture here. It just attracts that group of people that want to keep that patient front and center. I always say that it is that academic feel. So you get those highly trained and specialized physicians, but with the community feel of medicine, so we are smaller, and I think our patients appreciate that. I can tell you that in our oncology clinic and in our bone marrow transplant clinic, one of the things we always try to do for our patients is just cater to them. We try to make their care convenient. We have their specialists, whether it be the dermatologist, the pulmonologist, come to the clinic rather than sending them out to those different offices. We try to, when a new diagnosis is made, they need a PET scan, they need a port placed, they need their ultrasound of the heart done. We try to consolidate all of that into one day, sometimes no more than 2 days, just so that they're not making multiple trips into the facility. And that is just the expectation and the norm here. Everybody is of that mindset that we do what we need to do to cater to the patient.
Where can I find the right doctor? One who listens, is trustworthy, knowledgeable, and cares for me.
When life is uncertain, when you don't know what's next, we're on your side to help you find answers and understanding. With over 600 providers, Slu Care physicians combine an advanced approach to medicine with a human approach to you. It's what we call informed medicine.